3. Stagnant blood is where trouble starts. The blood clots I've seen do the most damage in my career are almost always the ones nobody saw coming. Clots form where blood moves too slowly, pools, or meets a damaged vessel wall, a process called stasis. And stasis doesn't only happen on long flights, it can happen every night in bed if circulation isn't supported. Sleeping on your back or right side for 8 hours gives blood more opportunity to pool in the deep veins of your legs and pelvis, a risk that climbs after 60 as circulation naturally slows and vein walls lose elasticity. Left side sleeping keeps the inferior vena cava clear and supports steadier blood flow through those same deep veins. Left side sleeping won't guarantee you never develop a clot. Clot risk is genuinely multifactorial, but consistently supporting circulation overnight is one legitimate tool worth having in your corner after 60. 4. Your brain's overnight cleanup crew. This next one still surprises me, and I've been reading the research for years. Your brain has its own dedicated waste clearance system called the glymphatic system. Think of it as an overnight cleaning crew that flushes out metabolic waste your brain accumulates during the day, including amyloid beta and tau, two proteins closely associated with cognitive decline. Research suggests this system works more efficiently during sleep, and that side sleeping in particular may support that drainage better than sleeping flat on your back. Some studies point to a possible added edge for the left side specifically, though I'll be straightforward with you. That piece of the research is newer and less settled than the venous return findings above. Why does this matter for your heart specifically? Because vascular inflammation in the brain is tied to stroke risk, and the brain and cardiovascular system are not separate systems. They share the same blood vessels. Protecting one supports the other. 1. Your heart sits left of center. Gravity can help or fight you. Your heart isn't dead center in your chest. Most of its mass sits toward the left side of your body. That's simply anatomy. Lie on your left side and gravity works with the direction blood needs to flow rather than against it. Picture carrying a heavy bag downhill instead of uphill. Same distance, less strain. Your heart beats roughly 100,000 times a day. Over a lifetime, that's a staggering cumulative workload. Anything that trims that workload, even slightly, even mechanically, adds up over years. After 60, when heart muscle may already be dealing with some stiffness, every bit of assistance counts. I'm not telling you left side sleeping turns back the clock on your heart. It doesn't. But it may let your heart do its overnight work a little more efficiently. Sleeping on your right side isn't dangerous. It's just working with a smaller mechanical advantage. 2. The vein. Most people have never heard of. Here's one your cardiologist may never have brought up: the inferior vena cava. It's the large vein carrying blood from your legs, abdomen, and pelvis back up to your heart, and it runs along the right side of your spine. Sleep on your right side, and the weight of your organs can press against that vein. Not a dramatic blockage, but even partial compression slows the return of blood to your heart, which means your heart has to work a little harder night after night, year after year to compensate. Sleep on your left, and that pressure lifts. Blood moves back more freely. This matters more after 60, when veins naturally lose some elasticity and the valves that push blood upward against gravity aren't quite as sharp as they used to be. Removing one unnecessary obstacle to circulation is a real, measurable, and completely free adjustment. 3. Stagnant blood is where trouble starts. The blood clots I've seen do the most damage in my career are almost always the ones nobody saw coming. Clots form where blood moves too slowly, pools, or meets a damaged vessel wall, a process called stasis. And stasis doesn't only happen on long flights. It can happen every night in bed if circulation isn't supported. Sleeping on your back or right side for 8 hours gives blood more opportunity to pool in the deep veins of your legs and pelvis, a risk that climbs after 60 as circulation naturally slows and vein walls lose elasticity. Left side sleeping keeps the inferior vena cava clear and supports steadier blood flow through those same deep veins. Left side sleeping won't guarantee you never develop a clot. Clot risk is genuinely multifactorial, but consistently supporting circulation overnight is one legitimate tool worth having in your corner after 60. 4. Your brain's overnight cleanup crew. This next one still surprises me, and I've been reading the research for years. Your brain has its own dedicated waste clearance system called the glymphatic system. Think of it as an overnight cleaning crew that flushes out metabolic waste your brain accumulates during the day, including amyloid beta and tau, two proteins closely associated with cognitive decline. Research suggests this system works more efficiently during sleep, and that side sleeping in particular may support that drainage better than sleeping flat on your back. Some studies point to a possible added edge for the left side specifically, though I'll be straightforward with you. That piece of the research is newer and less settled than the venous return findings above. Why does this matter for your heart specifically? Because vascular inflammation in the brain is tied to stroke risk, and the brain and cardiovascular system are not separate systems. They share the same blood vessels. Protecting one supports the other. 5. The reflux connection. Nobody expects now for something that might seem unrelated to cardiac health. Acid reflux. Stay with me. The connection is real. Chronic, untreated reflux causes ongoing inflammation in the esophagus, and that inflammation can irritate the vagus nerve, which runs alongside the esophagus and helps regulate heart rhythm. Researchers have observed an association between chronic reflux and certain arrhythmias, including atrial fibrillation, a genuine risk factor for stroke, particularly after 60. It's an association worth taking seriously, even though reflux is one contributing factor among several, not a guaranteed cause. Here's the anatomy. Your stomach sits toward the left side of your body. Sleep on your left, and the junction between esophagus and stomach stays elevated above the acid, so gravity keeps it where it belongs. Sleep on your right or your back, and that junction drops, making it easier for acid to travel upward. Less reflux means less esophageal inflammation, less vagus nerve irritation, and a more stable rhythm overall. 6. Nocturnal dipping, the overnight repair window. Here's a concept worth asking your own doctor about: nocturnal dipping. In healthy people, blood pressure naturally drops 10 to 20% during sleep. That dip isn't incidental, it's protective, giving your arteries, kidneys, and heart a genuine window of reduced strain and repair. Not everyone experiences that dip. People whose blood pressure stays elevated overnight, cardiologists call them non-dippers, show meaningfully higher rates of heart attack and stroke in the research, and that gap becomes more consequential with age. Sleep position plays into this. When circulation is compromised overnight, the body's stress response stays partially switched on. Cortisol and adrenaline remain slightly elevated, which is one of the reasons blood pressure fails to dip properly. Left side sleeping supports better venous return, and in people with positional sleep apnea may reduce apnea events, both of which support more consistent overnight dipping. If you're managing hypertension after 60, a 24-hour ambulatory blood pressure monitor can actually tell you whether you're dipping. It's worth asking your doctor about. A word for women, specifically. If you were pregnant at some point, you may already know this. Left side sleeping during the third trimester improves blood flow to the placenta, and it's one of the most consistently recommended positions in obstetrics. Many women learn this during pregnancy, then drift back to old habits over the following decades. If you did it once, your body already knows how. 2 more things matter specifically for women over 60. First, joint comfort. Side sleeping without support can strain the hips and misalign the spine. A pillow between the knees solves this almost entirely. Second, and more importantly, cardiovascular disease in women is still chronically underdiagnosed. Symptoms present differently, risk factors accumulate differently, and women's heart and stroke risk is routinely underestimated by patients and clinicians alike. Everything covered here, venous return, the glymphatic system, nocturnal dipping, applies fully to you, and your heart deserves exactly as much attention. 7. Sleep position and sleep apnea, a two-way street. I mentioned apnea a moment ago, and I want to spend more time there because I see this connection missed constantly. Obstructive sleep apnea happens when the soft tissue at the back of your throat relaxes and partially or fully blocks your airway during sleep. It's more common after 60, more common with extra weight around the neck and midsection, and this is the part people don't expect, significantly influenced by which way you're facing. Sleeping on your back allows the tongue and soft palate to fall backward more easily, which narrows the airway. This is called positional apnea, and for a meaningful subset of people, it's the majority of their problem. Roll onto your side, and gravity pulls that same tissue away from the airway instead of into it. Some patients who are diagnosed with mild apnea on a sleep study turn out to have almost all of their breathing events happening while lying on their back and very few on their side. Why does this matter for your heart? Every apnea event is a mini cardiovascular stress test, repeated dozens or even hundreds of times a night in more severe cases. Oxygen dips, your heart rate spikes to compensate, blood pressure surges. Over years, this is strongly linked to hypertension, atrial fibrillation, and heart failure. If left side sleeping helps reduce those events even partially, that's a direct line back to the heart, not just a comfort issue. I'll say clearly, if you snore heavily, if a partner has told you that you stop breathing at night, or if you wake up gasping or exhausted despite a full night in bed, that's worth a real sleep study, not just a pillow adjustment. Position can help. It's not a substitute for diagnosis. 8. What if you can't sleep on your left side? I get this question constantly, so let's deal with it directly. If you have heart failure with certain types of fluid buildup, some patients actually find left side sleeping less comfortable because of how the heart sits relative to the lungs when enlarged. This is exactly the kind of situation where talk to your own doctor isn't a throwaway line. It's the actual answer. Your cardiologist may have a specific reason for a different recommendation based on your echocardiogram. If you've had recent shoulder surgery, a shoulder replacement, or a rotator cuff repair, lying on that side is often physically impossible for weeks or months. That's fine. Prioritize healing. You can revisit position once you're cleared. If you have a pacemaker or defibrillator, most are implanted on the left side specifically so you sleep on your right, away from the device, at least during initial healing. Follow your surgeon's specific instructions over anything you hear in a video like this one. If you have significant hip arthritis, side sleeping on the more painful hip may simply not be tolerable, and forcing it isn't worth the pain. In that case, a slightly reclined back position with a wedge pillow, discussed with your doctor, is often a reasonable middle ground. The theme across all of these, this is one useful, low-cost adjustment among many things that matter for your heart, not a rule to force through pain or against medical advice. If your body or your doctor is telling you something different, that information outranks anything in this video. 9. A word for women. Specifically, if you were pregnant at some point, you may already know this. Left side sleeping during the third trimester improves blood flow to the placenta, and it's one of the most consistently recommended positions in obstetrics. Many women learn this during pregnancy, then drift back to old habits over the following decades. If you did it once, your body already knows how. 2 more things matter specifically for women over 60. First, joint comfort. Side sleeping without support can strain the hips and misalign the spine. A pillow between the knees solves this almost entirely. Second, and more importantly, cardiovascular disease in women is still chronically underdiagnosed. Symptoms present differently, risk factors accumulate differently, and women's heart and stroke risk is routinely underestimated by patients and clinicians alike. Everything covered here, venous return, the glymphatic system, nocturnal dipping, applies fully to you, and your heart deserves exactly as much attention. 10 myths I hear constantly. Let me clear a few things up because misinformation on this topic spreads fast. Myth: sleeping on your right side will cause a heart attack. No, this is an overcorrection of real research. Right side sleeping is not dangerous for the overwhelming majority of people. It's simply less mechanically advantageous than the left. Don't panic if you wake up on your right side. You haven't done damage. Myth: if I switch to my left side, it'll fix my blood pressure immediately. Also, no, this is a small, cumulative, mechanical assist, not a treatment. It works alongside your medication, your diet, and your activity level, not instead of them. Myth: back sleeping is always bad. Not universally true. Back sleeping with the head slightly elevated is actually the recommended position after certain surgeries, and it can be fine for people without reflux or positional apnea. The concerns I raised today apply most strongly to people managing those specific issues. Myth: you can train yourself in one night. Your body has spent decades in a default position. Realistically, plan on 1 to 4 weeks of transition, not one night. More on that in a moment. 11. Making the switch, a practical, step-by-step plan. If you've never been a natural left side sleeper, here's how to actually make it stick, not just how to want it to. Step 1. Block the roll. Place a firm pillow, a rolled towel, or a wedge behind your back. This isn't about forcing yourself awake to correct your position. It's a passive barrier that makes rolling onto your back or right side less comfortable, so your body drifts back to the left without you consciously doing anything. Step 2. Support your knees and hips. A pillow between your knees keeps your spine aligned and takes pressure off your hips, which is often the actual reason people abandon side sleeping within a week. Not the concept, but the joint discomfort. Step 3. Support your head properly. Too high a pillow curves your neck upward, too low lets it dip down. Either one causes morning stiffness that has nothing to do with your heart and everything to do with pillow height. A medium loft pillow that keeps your neck roughly level with your spine is what most people need. Step 4. Consider a body pillow. For many people over 60, a full-length body pillow does the job of the back wedge and the knee pillow at once, and it's simply easier to manage than juggling 2 or 3 separate pillows through the night. Step 5. Track it loosely, not obsessively. You don't need an app. Just notice over the first 2 weeks roughly how you're waking up. If you consistently wake up on your left or drifted only slightly off it, the habit is forming. If you consistently wake up back on your right or your back, adjust your pillow setup rather than assuming it won't work for you. Step 6. Be patient with the first few nights. New positions almost always feel slightly unfamiliar at first. That's not your body rejecting it, that's just unfamiliarity. Give it a full week before you draw any conclusions and a month before you stop thinking about it at all. 12. 2 patient stories. I want to share 2 brief composite stories, drawn from patterns I've seen repeated across many patients, not any single individual, because I think they illustrate this better than statistics alone. One patient, a man in his late 60s, came in for a routine follow-up managing borderline hypertension. Nothing dramatic, no acute event. In conversation, almost as an aside, he mentioned he'd been a lifelong back sleeper and had recently started noticing more reflux at night. We talked through positional changes, alongside his existing treatment plan, not instead of it. Months later, his reflux symptoms had improved enough that he brought it up unprompted. I can't attribute a blood pressure change to one variable in a case like that. Medicine is never that clean. But it was a clear example of how an overlooked daily habit can quietly compound alongside everything else being managed. Another patient, a woman in her early 70s, had been told years earlier during pregnancy to sleep on her left side, then drifted away from it over subsequent decades, like so many women do. When we discuss sleep position as one small piece of her overall cardiovascular picture, she said something that stuck with me. I already knew this. I just forgot I knew it. That's really the spirit of this whole video. This isn't new information for a lot of you. It's a reminder of something worth returning to. 13. What the research actually says, and doesn't I want to be fully transparent with you about the strength of the evidence here, because I think honesty matters more than hype. The venous return and inferior vena cava mechanics are solid anatomy and physiology, not controversial. The link between position and positional sleep apnea is well established in sleep medicine. The reflux and vagus nerve connection is a genuine published area of research, though the strength of the arrhythmia link varies across studies. The glymphatic system research, especially the left side specific findings, is newer, largely built on animal studies and a smaller number of human studies, and is still developing. I flagged that difference earlier for a reason. It's important you know which of these claims rest on decades of established physiology, and which are promising but still being worked out. What none of this is, a replacement for medication, a cure for existing cardiovascular disease, or a guarantee against a cardiac event. It's a genuinely low cost, low risk adjustment with a reasonable physiological basis, best understood as one small piece sitting alongside diet, exercise, medication adherence, and regular checkups, not above them. 14. Frequently asked questions. What if I wake up in a completely different position than I fell asleep in? Completely normal. Most people shift position multiple times a night, regardless of where they start. The goal isn't rigid, unbroken left side sleeping for 8 straight hours. It's shifting your overall tendency toward the left over time, especially during the position you spend the most total hours in. Does the side of the bed I sleep on matter, or just my body position? Just your body position relative to your own left and right side. Which side of the bed you're on doesn't matter at all. I sleep with a CPAP machine. Does this still apply to me? Yes, and in some cases even more so. CPAP therapy plus favorable positioning often works better together than either alone. Talk to your sleep specialist about position-specific settings if your machine supports them. Is there an ideal age to start this, or is it too late after 60? It's never too late. Vascular and circulatory benefits from position are mechanical and immediate, not something that requires years to build up before they help. Why I'm telling you this. I've spent my career looking at what a damaged heart looks like up close. Arteries thickened by decades of inflammation, the aftermath of strokes nobody saw coming. What stays with me isn't the dramatic emergencies, it's the slow, quiet damage that built up from thousands of small stresses nobody thought were significant at the time. Sleep position costs nothing. No prescription, no equipment, no appointment. You're going to sleep tonight regardless. The only real question is which direction you'll be facing when you do. I sleep on my left side, so do most of the colleagues who've looked closely at this research. Not because it guarantees anything, medicine rarely deals in guarantees, but because the mechanism is sound, the evidence is consistent, and the cost of trying it is exactly zero. In cardiology, we prescribe medications that lower risk by 15 to 30%, with real side effects and real costs attached. We almost never talk about the 8 hours every patient already spends horizontal and whether those hours are working for the heart or quietly against it. 6. Takeaways. Your heart sits left of center. Left side sleeping lets gravity assist the pump, and it adds up night after night. The inferior vena cava runs along your right side. Left side sleeping keeps it uncompressed and supports blood returning to your heart. Clots form in stagnant blood. Left side sleeping supports circulation through the deep veins, which matters more after 60. Your brain's cleanup crew works better during side sleeping. Less vascular inflammation may mean lower stroke risk. Left side sleeping reduces reflux, supports nocturnal blood pressure dipping, and protects the nerve regulating your heart rhythm. Left side sleeping can also reduce positional sleep apnea events, and every apnea event is its own small stress on the heart. Making the switch. Quick recap. If you've never been a natural left side sleeper, a firm pillow behind your back to stop yourself rolling over without noticing, a second pillow between your knees to keep your spine aligned, and a properly sized pillow under your head. Give it a week to start feeling natural and a month before you stop thinking about it at all. The body adapts fast, you're just pointing it toward a better default. What position have you slept in most of your adult life? Has a doctor ever brought this up with you? Tell me in the comments. I read everyone, and your experience might help someone else watching who's in exactly the same spot you were. If this was useful, share it with someone managing blood pressure or recovering from a cardiac event. This information shouldn't be hard to find. Everything shared here reflects current research and clinical experience represented as accurately and honestly as I can. It's general information, not personalized medical advice. Your situation is your own. Before changing anything about your routine, especially if you're managing an existing cardiac condition, a pacemaker, heart failure, or recent surgery, talk to your own doctor. They know your full history. I don't, and that distinction always matters in medicine. Your heart has been working for you every minute for 60, 70, 80 years without asking for much. Tonight, give it a little help.